The second objective is list anti-malarial drugs used for radical cure. Now, what is radical cure? Radical cure requires the administration of a combination therapy. It includes the blood stage treatment and in combination with the liver stage treatment to clear all parasites. And generally, the radical cure therapy recommended for the Plasmodium vivax. There are two main stages. Blood stage treatment, we can say blood schizonticides. So in this stage, the protozoas have to be killed in the blood, and in the liver stage treatment, the term is considered as tissue schizonticides, and in this case the protozoa should be killed in the liver stage. So generally for the blood stage treatment, the chloroquine is recommended, or in areas where chloroquine resistance is prevalent, then we have to consider artemisinin based combination therapy to clear the blood stages. The artemisinin combination therapy ACT, we will discuss what is this. Liver stage treatment, tissue schizonticides, and it contains two drugs, primaquine and tafenoquine, to clear hypnozoites in the liver. Hypnozoites, it is the stage of the life cycles of the protozoa, and we have to kill these protozoas in the liver. It's called hypnozoites. So primaquine and tafenoquine should be not recommended in the pregnant woman. So if there is a pregnant woman, what is the protocol for the treatment of the pregnant woman is different. We will this is a different, we will see. So for the radical cure, and for the radical cure generally, chloroquine used for the blood stage, we can say blood schizonticide, and the primaquine and the tafenoquine, these are both from the category of quinoline, and it is used for the tissue schizonticides. Tissue includes the liver. Third objective, list anti-malarial drugs used to prevent transmission. Now here, please clear the terminology. Transmission is not from one person to another person. The transmission is within the protozoa, and this stage is called gametocytosis. Gametocytosis. These drugs destroy the sexual forms of the parasite in the blood and thereby prevent the transmission of infection to the mosquito. So please keep in the mind, if there is a question, give the two name of the drug, prevent the transmission. So drugs are same. We can use chloroquine, primaquine. These are the uh, preferred drug. But prevent the transmission means these drugs destroy the sexual forms of the parasites in the blood and thereby prevent transmission of infection to the mosquito. But do not confuse with the prophylaxis, prevention. That is was first we seen, that is to use to prevent the malaria. It's different one. Prevention, prophylaxis, and transmission, destroy the sexual forms of the parasite in the blood, human blood, and thereby prevent the transmission of the infection to the mosquito. If you know the life cycle of malaria, mosquito, you are able to get what is gametocytosis. Which are the drugs? Chloroquine and quinine have gametocytocidal activity against Plasmodium vivax, Plasmodium malaria, but not against Plasmodium falciparum, which is a big challenge. Plasmodium falciparum. And so, which is the best drug for the Plasmodium falciparum? Primaquine has gametocytocidal activity against all Plasmodia, including Plasmodium falciparum. So, if you just remember the primaquine, yes, it is can be used to prevent the transmission for all forms of the malaria. And but primaquine should be contraindicated in the pregnant women and the person which is having glucose 6 phosphate dehydrogenase deficiency. Next objective, fourth one, list the anti-malarial drugs belong to quinoline groups and describe their mechanism of action. Quinoline group, and mention the clinical uses, adverse drug reactions, contraindications, drug interactions of quinoline drugs. Now we will see which are these drugs from the quinoline categories. These are the six drugs preferred for the quinoline categories. The first one is the quinine, chloroquine, hydroxychloroquine, mefloquine, primaquine, and tafenoquine. These are the drugs from the quinoline categories. What is quinoline? Quinoline, according to the chemistry parts, according to the chemistry, quinoline, it is generally the two benzene ring, six-member ring with one amino group, quinoline, and there is two quinoline groups, four amino quinoline and the eight amino quinolines. So for the information, just click on the drug name. You will be landing to the specific page. Now first we will go to the chloroquine. Just click on the chloroquine. If you have the file, just click on this chloroquine. You will be moved to the pharmacology of the chloroquine, and this is the chloroquine. As per our objective, you will get the use. First one is the use. It is used for the malaria, and it is used for the prophylaxis, prevention, and the treatment. It is also used for the amoebiasis, and if you see here, it is mentioned for the coronavirus disease COVID-19, but please, in the bracket, it is mentioned off label. Off label means it is not, it is not recommend, it is not approved, approved by the US FDA. And if you see, FDA revoked the emergency use authorization that chloroquine donated before, but now there is no use because there is not approved. So this is the use of the chloroquine, the malaria, amoebiasis, and there are many more. Adverse effect, if you click on the adverse effect on the left hand side corner, you will get, these are the adverse effect. If you see the adverse effect, see the cardiac disorder, you will see the most important ones. Hypotension, ECG changes, particularly inversion of the depression of the T wave with widening of the QRS complex. Cardiomyopathy, cardiac arrhythmias, conduction disorder, AV block, QT interval prolongation, torsade D points, ventricular tachycardia, and ventricular fibrillation. The most important adverse effect, because most of the patients from the cardiovascular problem, and it should be taken in mind. Also, the person having the neuropsychiatric disorder, psychosis, delirium, anxiety, agitation, insomnia, confusion, hallucinations, personality changes, depression, suicidal behavior, nervous system disorder, blood and lymphatic system disorder, anemia, thrombocytopenia, skin and subcutaneous tissue disorder, gastrointestinal disorder, including hepatitis, musculoskeletal and connective tissue disorders, ear and labyrinth disorder, immune system disorder, and ocular disorder, the most important, ocular, maculopathy, macular degeneration, visual disturbances should be occurs, and so it should be avoided in the persons which is having these problems. There are also some warnings, contraindications, hypersensitivity to chloroquine. There may be chances of the psoriasis, porphyria, retinal or visual field changes. Pharmacology, mechanism of action, active against erythrocytic forms of the Plasmodium vivax and Plasmodium malaria and most strains of the Plasmodium falciparum. But precise mechanism of action is not known. There is an the pharmacokinetic absorption, distribution, metabolism, and excretion. So this is about the chloroquine. Drug interactions, these are the interactions available, and these all the drugs are contraindicated if you give chloroquine and these drugs with together. There may chances of the drug interactions. See, so much, not one or two. So this is about the chloroquine. Each drug is provided with the pharmacology. Just you have to click on this drug and you will be landing to uh, the pharmacology page. Now we will see the primaquine. Just click on the primaquine and you will be landing to the pharmacology page of the Medscape's primaquine. Prevention of the relapses of the Plasmodium vivax malaria, uncomplicated Plasmodium vivax and Plasmodium oval malaria. It is also used for the off-label use as a prevention purpose. What is the adverse effect of primaquine? More than 10% of the patients may feel the abdominal pain, hemolytic anemia in glucose 6 phosphate dehydrogenase deficiency, hemolytic anemia, nausea, vomiting, and there are minor also. What is the contraindications? Severe glucose 6 phosphate dehydrogenase patients deficiency, use of the pregnancy. If you click on the pregnancy, and it is recommended, it is not recommended to use in the pregnancy, contraindicated in the pregnant women, even if pregnant woman is glucose 6 phosphate dehydrogenase normal. The fetus may not be safe. Uses in pregnancy not established. Use during pregnancy should be avoided except when in judgment of the physician's benefits overweight possible hazards. Sexually active females of reproductive potential should have pregnancy tests prior to starting the prima queen. So in also lactation, the Center of Disease Control recommend do not use in nursing woman unless breastfeed infant has been determined not to have glucose 6 phosphate dehydrogenase deficiency. What is a pharmacology? It disturbs the plasmodium's mitochondria, absorption, metabolism, and eliminations. So this is about the primaquine. Each drug, if you click on the each drug, you will get all the pharmacology, includes the clinical use, adverse drug reactions, contraindications, drug-drug interactions, all these things. So this is for your homework. You have to please click on the each drug and you will get all the pharmacological information as per our objectives. Let us move to towards the next objective. List anti-malarial drugs belong to antifoliate group. Antifoliate group, the drugs which inhibit the folic acid synthesis in the protozoas. And which are these drugs from the antifoliate groups? These are the progonil, and generally progonil is not used alone. It's used approved within combination with the atowacone and progonil. Its uses with the atowacone and the progonil. Second drug is pyrimethamine, and it is also antifoliate drug. It how it act, mechanism of action, it inhibits the folic acid synthesis, as the name indicate, antifoliate folic acid in the protozoas. So progonil and the pyrimethamines are the drugs belongs to category of antifoliate group. Just click on the drug link, you will get all the informations regarding to the atowacone and the progonil. Let us see atowacone and the progonil. It is used in the malaria. This is a dose. As per this, we will see the pharmacology. It is anti-parasitic activity. Atowacone selective inhibitors of the parasite mitochondrial electron transport, and the progonil primary effect through the metabolite cyclogonyl dihydrofolate reductase inhibitor in malaria parasite, which leads to disruption of the deoxymedylate synthesis. So indirectly, it inhibits the folic acid synthesis. Adverse effects: abdominal pain, most of the cases more than 10%, and the warning: hypersensitivity and renal impairment. Next objective: list the anti-malarial drugs belongs to antibiotics to describe their mechanism of actions, clinical use, adverse drug reactions, contraindications, drug interactions. So which are the antibiotics? Tetracycline, doxycycline, and the clindamycin. These are the antibiotics generally used for the prevention, for the treatment of malaria: tetracycline, doxycycline, and the clindamycin. The tetracycline and doxycycline inhibits the protein synthesis, and the clindamycin from the lincosamide group. Just click on the name of the drugs and read it to save the time. This is your homework. You can read, and if you have any problem, you can ask me anytime. Next objective: describe the pharmacology of drugs used to treat leishmaniasis and the filariasis. Before going to leishmaniasis and filariasis, I wish to complete some additional information about treatment protocol about the malaria. Let us see. Malaria management algorithm. Center for Disease Control and Preventions has made some protocol guideline for the management of the malaria. The malaria management, they are categorized into two main categories: severe malaria and uncomplicated malaria. Severe malaria and uncomplicated malaria. What is the severe malaria? If the patient is unable to tolerate oral medications, plus regardless of the species, any species, and plus if the hemoglobin count is less than 5 milligram per dl, the case is considered as severe. And for the severe malaria, as per the control Center for Disease Control and Preventions, they recommended some protocol. Admit to intensive care unit, and which are the drugs are available here? Intravenous artesunate. Yes, we have to see what is artesunate. Artesunate, it is from the category of the artemisinin. Artemisinin, which is anti-malarial drug, and it is generally used intravenously for the severe malarial cases. If needed, interim treatment, artem ether. The second derivative of the artemisinin is artem ether. There is three main derivatives of the artemisinin: artesunate, artem ether, and hydroxy artemisinin. So artesunates generally given as a single drug without combination intravenously, and if the patient is not able to tolerate, not responsive, if needed, interim treatment should be given: artem ether plus lumapentrin. This combination is approved. Artem ether and the lumapentrin. We will discuss the pharmacology of this drug, artesunate and artem ether and lumapentrin. So it is generally preferred. Or we have another options: atovaquone progonil or quinine. And if there is no other options, mefloquine. Only these drugs are preferred in the severe malaria. Administer follow on treatment after intravenous artesunate, artemether lumefantrine, atavacone progonil, or quinine and doxycycline and clindamycin, and the last one is mefloquine. These are the medications used for the severe cases. Okay, any species, if the severe case maybe from the Plasmodium vivax, Plasmodium oil, Plasmodium falciparum, or Plasmodium malariae. So most one preferred topmost one is give one intravenous shot of artesunate or artemether lumefantrine or atavacone progonil, quinine or mefloquine. According, this drug should be decided by the doctors according to the availability, according to the patient history, and according to the situations. Now, uncomplicated malaria, which is not severe. And let us see the management for these cases. If it is uncomplicated malaria and if the species is Plasmodium malariae, just give chloroquine or hydroxychloroquine, because generally this species of the Plasmodium malaria are sensitive to the chloroquine. Plus Plasmodium ovale if the infection uncomplicated malaria by the Plasmodium ovale or Plasmodium vivax acquired in area without chloroquine resistance, you can give chloroquine and hydroxychloroquine. Plus here, you have to consider if not glucose 6 phosphate dehydrogenase deficiency by the quantitative testing, if the patient is responsive to the chloroquine, no need for the another medications. If it is not responsive, you can add primaquine, but test before giving to the primaquine, test for the glucose 6 phosphate dehydrogenase or tafenoquine only if chloroquine used for acute infection, not for children less than 16 years old. And we cannot give primaquine and the tafenoquine in the pregnant women's, so consider the chloroquine. If the malaria by the Plasmodium vivax acquired in the area with the chloroquine resistance, so we have to give artemethyl lumefantrine, same which are used before in the severe case, etowacone progonil, same used before in the previous case, quinine plus tetracycline or doxycycline or clindamycin. These are the antibiotics. You can choose one antibiotic, or if no other options are available, you can use mefloquine. But what is the problem here? If the species develop resistance to the chloroquine, there is chances of this species may develop resistance to the mefloquine. So that's why consider the primaquine and the tafenoquine. And before this considering primaquine and tafenoquine, consider the glucose 6 phosphate dehydrogenase test. Now, the most important, most challenging one is Plasmodium falciparum species or species which is not identified. Admit the patient to the hospital and test for the Plasmodium species. Now, there are three categories. If the Plasmodium falciparum species acquired in area with no chloroquine resistance, give the chloroquine. If there is a no chloroquine resistance area, give the chloroquine or hydroxychloroquine. But if the Plasmodium falciparum acquired in area with chloroquine resistance, then artemether and the lumefantrine preferred, and it is the drug of choice for the uncomplicated malaria caused by the Plasmodium falciparum species. Again, the choice of treatment or which drug prefer in uncomplicated malaria caused by the Plasmodium falciparum, considered artemether lumefantrine combination preferred one. Or if it is not available, according to the patient condition, patient history, etowacone progonil or quinine plus antibiotics, tetracycline, doxycycline, or clindamycins. And if no other options are available, last one is mefloquine. Same. And third one is Plasmodium falciparum acquired in area with mefloquine resistance. If there is a mefloquine, don't give mefloquine. If there is a mefloquine resistance, then avoid the mefloquine and you can give artemether lumefantrine, which is preferred regimen, etavacone, progonil, or quinine. You can add the antibiotic tetracycline, doxycycline, clindamycin. So these are the treatment protocol by the Center of Disease Control and the Prevention. If you see, there are only some common medications We seen all the medications repeated, but we didn't see the repeated medication, that is artesunate. That's why the artesunate should be given only in severe cases by intravenous. So artesunates is reserved for only severe cases. We didn't see in the uncomplicated malaria the use of the artesunate. So please keep in mind artesunate should be reserved for the severe cases. And if there is no artesunates, which are the preferred one? Artemether lufapentine combination or atavacone progonil combinations. Atavacone is from the category of the quinoline and the progonil from the category of antifolate. And you can add the mefloquine, which is also from the quinoline categories. So if you see the line of treatment, last line of management, you will see only artemether lumefantrine, atavacone progonil plus antibiotic tetracycline, doxycycline, clindamycin, and the last option is, if not available, mefloquine. And where to use chloroquine? Yes, if there is uncomplicated malaria, you can go for, if the malaria is caused by the Plasmodium malaria, Plasmodium ovale, or Plasmodium vivax. You can give, if there is a area without chloroquine resistance, you can give chloroquine or hydroxychloroquine. If there is a chloroquine resistance, you can switch to the mefloquine, or if there is a mefloquine resistance, then we have the preferred one is artemether lumefantrine or atavacone progonil or quinine, quinine plus antibiotics like tetracycline, doxycycline, or clindamycin. There is or, not all. You have to choose from the antibiotic any one, either tetracycline, either doxycycline, or either clindamycin. Among these antibiotics, the doxycycline is preferred one. Doxycycline, because it has less adverse effects as compared to tetracycline. So these are the only main hub of medicine drugs we can utilize for management of the malaria. For your additional reading, there is another chart table is given by the CDC, and they have given the detailed information regarding the um, each treatment protocol. Uncomplicated malaria in the pregnant women, so which dose is preferred? So generally the chloroquine is given and preferred for the second and third trimester. Species and the drugs susceptibility, if there is a chloroquine resistance or it is Plasmodium falciparum, all malaria endemic regions except Central America, west of Panama, because they have the data, that's why they put it there. Regions, Plasmodium vivax, Plasmodium ovale. Now, which is the preferred one? Recommended management for the uncomplicated malaria in the pregnant women, and it is generally preferred in the second and the third trimester. The drug is artemether and the lumefantrine. Yes. And in all trimesters, you can give quinine sulfate plus clindamycin. If no other options are available, all trimesters consider mefloquine. So mefloquine and quinine can you consider for the all trimesters.